Hello and good evening. I'm Melissa Idris.
And I'm Sharad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Last week, National Recovery Council Chairman Tan Sri Muhyiddin Yassin recommended to the government to fully reopen Malaysia's international borders as early as next month, this without the need for mandatory quarantine. However, the proposal has yet to be discussed or approved by Cabinet. Now, currently, the only quarantine-free international travel allowed is the Malaysia-Singapore border via the vaccinated travel lane. Now, what considerations should policymakers weigh when considering how and when to fully open borders? Let's speak to Jayan Menon. He's Senior Fellow at the ICS Yusof Ishak Institute in Singapore. Jayan, the recommendations, the NRC's recommendations to fully reopen Malaysia's borders, it's really highlighted the debate that's come to the forefront with Omicron particularly, whether it's the better approach to tighten restrictions, to hunker down, to stem the spread, or to ease restrictions and to live with the virus. And that would mean international travel and minimal quarantine. Where do you stand on this, Jane?
Right. Okay. So I think the best way to think about this is a two-stage process. So at the first stage, you have to decide whether you want to live with this virus or what balance you want to strike between health and economy. Basically, I think we're all moving towards more of the economy now, or the opening up after 2 years of dealing with this virus, and with clear evidence that Omicron is not as virulent as previous variants. Now, having struck that balance, there's many ways in which you can open up. So far, the focus has been overwhelmingly to keep borders closed and to free up domestic movement. The problem is that we have a highly transmissible variant. Keeping borders open or closed will hardly affect the national infection rate. What will affect national infection numbers is domestic restrictions. So the value of border restrictions fall dramatically the more transmissible the variant is. And right now, you couldn't even import this variant in large numbers if you tried to. Most of the infection cases are domestically transmitted in the community. So keeping borders closed has a very high cost, but very little benefit in terms of health outcomes. So I would say Malaysia is on the right track in seriously considering opening up to international movements with some checks and balances like testing in place. But I think the time for quarantine has ended. There's really no value in continuing with quarantine if you can do the testing in place of quarantine.
Jen, very interesting, and I guess it's also your location in a country like Singapore. It's highly globalized city-state, but very controlled borders. I mean, Malaysia, and I was just looking this up. I mean, we have a land border with Thailand that's almost 600 kilometers long, almost 2,000 kilometers worth of border with Kalimantan, and a very porous sea border on the west coast of the peninsula. I mean, for Malaysia, the impracticalities. I mean, we often think about border controls in terms of airlines and flights. But the reality for a country like Malaysia is much. What would you say to countries like Malaysia, Indonesia, and sort of island Southeast Asia in terms of not only the practicality, but the downsides, the costs of these border controls?
Yeah, I think that's a very important point. I mean, there are countries that can police their borders much more efficiently than others. As you say, Singapore can do it a lot better. Australia could do it quite well, and New Zealand. But there are porous borders when it comes to most other parts of Southeast Asia, including Malaysia. And I think this emphasizes or re-emphasizes the, the lack of value from trying to enforce these types of controls, or the difficulty of enforcing or implementing these border restrictions. But you get the costs without the actual value. And at the end of the day, as I said earlier, there's really not much benefit, even if they were effective. It's even worse if you try to enforce them and they are not effective. So I think, if anything, the porousness and the difficulties of policing borders strengthens the case for opening. And I want to just finally say what I'm calling for really is to even up the gaps between domestic and border restrictions. Domestic restrictions on movement have been falling for a long time, and now they're almost completely gone, actually. But border restrictions have not come down as quickly, and so there is that gap between the border and at the border and within the border, and we should narrow that gap. There's a lot of value in narrowing that gap. Yeah.
Well, there seems to be a divergence in the way different countries are approaching this. You know, if you take a look at, say, some of the countries in the West, the Western countries are pushing to reopen, whereas some countries in Asia are hunkering down, are actually tightening restrictions. Japan's isolationist policy, matched only by China's very strict policy, the zero COVID approach. How do you think the differences of different countries in taking approach towards easing restrictions, particularly travel restrictions, how might that impact trade and the dynamics and the inequality of the global scenario?
Right. I think what we can clearly say is that Asia has been the outlier when it comes to opening borders to people movement. Europe and North America have now long opened up their borders to people movement. Trade is a different issue. Asia has been remarkable in terms of its ability to bounce back with trade. In fact, current levels of trade are already about 20 to 30% higher than pre-pandemic levels. So this has been, a driving force behind the economic recovery. But the conservatism in non-essential travel in Asia has been startling, and unnecessarily so. I think, the tourism sector, which is a large employer of low-skilled workers, either directly or indirectly, has been decimated in many countries in Asia, many poor countries, but also countries like Malaysia suffered greatly by these border closures to leisure travel. And I think the poor have suffered disproportionately, and this has contributed further to rising inequalities. So opening borders to non-essential travel, not just for tourism, but also for health tourism, not just leisure tourism, health tourism, education, etc., is very important for reviving these economies and reinstating livelihoods, especially for low-skilled workers that don't have many other options of employment.
Jayant, what do you think is driving policy across the world? Is it ideology? Is it the science of the disease? Is it, a proper sense of balance between the various contending objectives any country might have, health, but also a healthy economy? What do you think is driving it?
I think it's a combination of all of those things, and it varies by country. The combination shares vary by country, but it's always all of those things. And then on top of that all, we have this layer of illogical fear. I think that's really the problem. I mean, when the dust settles and we get to look at what's happened, I think, with our response to this pandemic, I fear we might find that the unintended consequences on health of these lockdowns may almost match what the virus has been capable of doing directly. There's been a lot of indirect effects from this response. on health, operating not just through the economy, but also directly in terms of, limiting access to hospital care for every other chronic disease that, these sort of COVID obsession has caused. When it comes to wards being filled with COVID patients that are not at any serious risk of injury to long-term health or death. So I think, it's a combination of all those things you mentioned, and we've seen this before as well with different types of pandemics. The AIDS crisis was another classic example where we know that, we had people saying that 5 could get infected at one point, but we know now that this was highly exaggerated, and the response was unnecessarily dramatic, but we never seem to learn. We keep doing this over and over again because somehow when it comes to health, nothing is too much, which is not true. Too much can have negative impacts on health in different ways, sometimes through livelihoods and not just through lives directly.
Can I ask you, when news broke about the recommendation by the National Recovery Council to fully reopen borders, opinion was really split. There was some that was really for this, living with the virus and also the recovery to the economy, but others, saying, is this craziness? Have we not seen the numbers? The peak of Omicron is expected at the end of March. And I'm just wondering whether that public buy-in, public support is necessary, whether you're seeing it being taken into consideration in Singapore's approach, and whether there are countries that you've noticed that are doing it right, getting the communication right, getting the easing of restrictions right, taking into account the public buy-in.
Yeah, that's a good point. I think, different countries experience different levels of trust with their governments. The level of trust in Singapore is quite high. And you have, a society that's willing to give up quite a bit of their freedoms, etc., in good faith, expecting the government to do the right thing. That is partly a sign of good communication or reflection of good communication, but it's also existing, I guess, cultural phenomena, and not unjustified. I mean, Singapore's government has done well by its citizens in terms of providing high standard of living, at the very least. We can talk about other issues, but so there is that aspect which exists, and communications, a good communication policy is one part of it. But I think the politicization of the problem has been a key factor, and some countries have exploited it to different degrees, using this as an opportunity to increase controls and to take away some freedoms when it benefits, an external objective. That is another issue and varies by country and depends on the electoral cycle as well, to some extent.
Right.
Yeah.
All right. Thank you so much, Jayan, for joining us on the show. That was our conversation with Dr. Jay Menon from Asia's Yusof Ishak Institute in Singapore. We're going to take a quick break here and consider this. We'll be back with more on this topic. Stay tuned. Hi, thanks so much for staying with Sharad and I on Consider This. Let's continue our look at the conversations that have come up from the recommendation by the National Recovery Council, urging the government or recommending the government to fully reopen Malaysia's international borders without mandatory quarantine, this as early as next month. Joining us now, we have the MP of Kopeng and former Deputy Health Minister, Dr. Lee Boon Chye. Dr. Lee, do you think Malaysia should fully reopen our borders now without mandatory quarantine?
I think at the moment it's still a bit too premature. No doubt that we are at a tipping point where we should review our SOP and opening border and those control measures versus the price we may have to pay because of the pandemic. There will be a point in time where the control measure can be more detrimental than the disease itself. So that should be the time where we can consider easing SOP and opening up border. But at the moment, I think it's not appropriate time because the numbers still climbing. We're not sure. I think it's too premature to judge whether our healthcare system will be overloaded or not. So we probably need to observe until the peak is over, the Omicron wave is over, then we can probably make judgment then. Even though I'm quite positive going forward, but I think timing is crucial.
Dr. Lee, there's been a lot said that, essentially Omicron is proceeding through community spread. The question is, how much of a difference does the importation of infections make to the overall scenario? And if we talk about trade-offs, whether restrictions that are placed on border controls, especially through airlines and flights, will make a huge amount of difference when we have such porous borders throughout the country. Over 2,000 kilometers worth with Indonesia in the Borneo states, and of course with Thailand, and we've had a porous border, sea border on the west coast of the peninsula, for which so much smuggling happens, people and goods. How realistic is this border control that we talk about?
I think most important thing is we need to have to look at the thing holistically, meaning that we got to balance the impact, the health impact of the pandemic versus the price we pay for control measures. And the control measure is not just the border, it's also all the SOP we put in place, the urging of testing, quarantine we put in place, and there should be a consistent policy throughout in terms of control measures. So there will be a time where the pandemic control measure become more costly compared to the healthcare impact. If that's the case, then it's the time we review the SOP, we ease the control measure. But I'm not sure this is the time.
Can I ask you about sorry, please finish, Dr. Lee. The other thing you're saying?
No, because the other thing is about border control. We cannot be instituting open borders at the time where we're still putting restriction on our local community. That doesn't make sense. If we think that we can open up the border, it will mean that we are quite comfortable with the pandemic situation. Then we should be easing all the SOP within our own compound before we even allow the border to be open fully. So you can imagine that if you are a business owner, you're subjected to so much of restriction and you pay so much to keep SOP in place, and the government allows free movement of people in and out of the country. That is totally unfair. I think we need to look at it holistically so that there should be a consistent policy. If we think it's okay, then we should be easing the SOP and opening up the border in stages.
Right. Can I ask you about a specific control measure, the quarantine? So in thinking about reopening borders, the key aspect is to fully reopen without the mandatory quarantine period. When do you think that decision, what does the science say about the need for quarantine, about doing away with quarantine, and how should public health policymakers be thinking about that?
I think that quarantine, we need to be consistent, whether you are international travel or whether you are domestic contact. Say, for example, if I am close contact of a COVID case, do I quarantine myself? Certainly, yes. At the moment, the policy says yes. Even if I'm fully vaccinated, I still be required to be quarantined for about 7 days. But international travel, because they are certainly very high risk in terms of contracting infection within an enclosed environment, within in airport, in aircraft, and certainly they carry high risk. And it doesn't make sense if we are subjecting our local close contact for quarantine, and we allow international travel to come in without quarantine. So the policy has to be consistent. There may be a time. There may be a time that we can do a week quarantine, just like we deal with ordinary flu.
All right. Dr. Lee, then why do you think the National Recovery Council made that recommendation to fully open borders without quarantine as early as next month?
Well, I think that you have to ask the chairman of the Recovery Council. But I also feel that that's unfortunate when Tan Sri Muhyiddin were to make the announcement, because such announcement should have been decided in the cabinet, should be coherent in nature, so that it doesn't give the impression that this country, as far as the COVID control is concerned, we have three leaders. One, the Health Minister of Health, one, National Recovery Council Chairman, and one, the Prime Minister who leads the cabinet. We are like running at three captains, sometimes when they are going in different directions. So I think that's unfortunate. It should have been a consistent cabinet decision led by Prime Minister.
Dr. Lee, I want to ask you about the Ministry of Health. And, since so much of the discussion around infections and people with severe COVID, and I'm sorry, more than just infections, just people with severe COVID are putting stress on the health system. Have you seen anything significant done to bolster our healthcare system in the last 2 years that helps us deal with these surges now, especially in view of the fact that we have had such a high vaccination rate?
Well, certainly, you look at the healthcare system, which is unfortunate. I think it's not just the healthcare system. In fact, the whole civil service bureaucracy, they are hoping that we'll go back to 2019 after the pandemic. But I must say that post-pandemic, the world we are facing is totally different. We can't go back to 2019. That's number one. Number two, even though I give credit to the recent increase in number of permanent posts for doctors, dentists, and pharmacists, but I think the number is still far short. We should be using this pandemic as an opportunity to increase healthcare expenses, because I'm sure the acceptance of greater expenditure in healthcare will be very much higher during this time. And our expenses for healthcare has been below what is to be expected of our income levels. So there is a need for us to strengthen our public healthcare or preventive part of it, to deal with not just the pandemic, also to deal with a lot of communicable diseases, to deal with the NCDs, and also deal with surge in mental health illnesses. So I think these are areas where I think the Ministry of Health should have done to increase not just the human resource, but also increase the allocation for Ministry of Health.
All right. Thank you so much for speaking with us today, Dr. Lee. It's been a pleasure. That was our conversation with former Deputy Minister of Health, Dr. Lee Boon Chye. That wraps up this episode of Consider This. I'm Melissa Idris.
And I'm Sharad Kuttan, signing off for the evening.
Thank you so much for watching, and good night.